Hello everyone, this video is provided to you by Community Health Systems Inc. and we will be covering the importance of understanding mental health and stigmas. Before I begin, I would like to let you know that this presentation is meant for educational purposes only. If you or anyone you know is experiencing a mental health crisis, please dial 911 or reach out to the National Suicide Prevention Lifeline at 1-800-273-8255 or head to the nearest hospital. It is necessary to understand how common mental health illnesses are amongst adults by race. On this chart, we can see that 16.3% of Hispanics, 19.3% Caucasians, 18.6% African Americans, 13.9% Asians, and 28.3% of American Indian and Alaska Native adults are living with mental health conditions. According to Arundel Lodge, minority groups receive treatment at lower rates than non-Hispanics. However, the rate of need for services may not be that different. In a couple of minutes, I will talk about the challenges faced by minority groups to better understand why they do not seek mental health services. On this slide, you can see how 20% of Latinos who experience a mental health disorder have talked to their primary care doctor about their symptoms, but only 10% actually contact a mental health professional. There are 4 common mental health disorders, which are anxiety, depression, post-traumatic stress disorder, which is most commonly known as PTSD, and alcoholism. For the 4 disorders, I will go over what they are and what are the signs and symptoms. Anxiety is when there's an emotional response when one feels threatened or worried about their future and can affect daily activities such as job performance, relationships, and schoolwork. Some of the symptoms may include having trouble sleeping, being irritable, and getting distracted. Depression is a common and serious mood disorder that affects how one feels, thinks, and handles daily activities such as sleeping, eating, or working. Some of the symptoms may include feelings of hopelessness, loss of interest or pleasure in hobbies and activities, and appetite or weight changes. PTSD is a disorder that some people develop after experiencing a dangerous, scary, or shocking event, such as physical and sexual assault, abuse, disasters, car accidents, or other traumatic events, and some of the symptoms may include flashbacks, bad dreams, and frightening thoughts. Alcoholism occurs when an individual can no longer control their consumption of alcohol and may experience stress when they do not drink alcohol. Some of the signs may include that the person is spending a lot of time obtaining, using, and recovering from the effects of alcohol, that they also may have a desire to drink more and continuing to abuse alcohol despite the negative interpersonal or social problems that it causes. Additional mental health facts and statistics would also include that there are language barriers and or cultural issues or differences, and that minority populations are more vulnerable than others to mental health illnesses and are less likely to receive diagnosis for their behavioral health issues, while 1 in 4 Americans suffers from a diagnosable mental health disorder. Minority groups are more vulnerable than others to mental health illnesses due to many reasons. When there is a language barrier between patients and their primary care provider, this makes the communication between both extremely difficult. If non-English speaking patients have providers that speak their language and understands their culture, this can make visits a lot more successful. Cultural stigma is common in minority groups because many believe that people who seek professional help should just stay quiet. Discrimination also occurs in the healthcare system. Low-income and minority groups may be hesitant to seek mental health care because of fear and mistrust due to events where patients were not treated appropriately. Due to the lack of behavioral health information amongst minority groups, it is important to have a behavioral health professional explain the role it plays. Once the patient and family member understands how chemicals affect a person's brain, they view the disorder differently and are more understanding of what is occurring. Some people may not seek mental health services from a healthcare professional because they feel more comfortable asking friends, family members, or spiritual leaders for advice. or they do not have healthcare access due to barriers they may face. Currently, many people are facing difficulties during the coronavirus pandemic, and it is completely normal to feel sad, stressed, or scared. On this slide, I will cover ways to cope with stress levels during these trying times. Talk to your loved ones over the phone, video calls, or social media. This is a safe way to social distance. It is important to limit the amount of time watching or listening to the media. Taking breaks from updates is a nice way of relaxing the mind. Therefore, it is important to use the skills used in the past to manage stress and emotions. Having a healthy lifestyle is also important because maintaining a healthy diet, proper sleep, and staying active at home can also help decrease stress. Avoid smoking, drinking, or using drugs is critical because this is not the best way to deal with our emotions. If you currently feel overwhelmed, you can always contact your local CHSI behavioral health professional to receive the proper care needed. Here are additional coping mechanisms for COVID-19. You can take care of your body by doing yoga. This is a great exercise to help you stretch your muscles if you are feeling tense. Focusing on goals is also important. You can always go back to school by taking online classes, read a book you always wanted to finish, and begin or finish a home project. Knowing the facts is really important because myths can make you become more stressed. We offer behavioral health services in Bloomington, Riverside, Moreno Valley, and Fallbrook. At CHSI, we offer compassionate care to individuals, couples, children, teenagers, adolescents, and families. Our behavioral health services include but are not limited to depression, anxiety, anger, postpartum depression, substance abuse, trauma, or coping strategies. We are currently offering telehealth visits with our behavioral health providers. Bilingual health professionals are also able to assist. This means you can have over the phone or video visits from the comfort of your home. Here's a list of insurances and programs we accept but are not limited to: Medi-Cal, Medicare, CHDP, Family Pact, HMOs, PPOs, private insurances, and the sliding fee scale, which is based on family size and income. Here at CHSI, we offer application assistance for families who wish to enroll in Medi-Cal and cover California health plans. Here's a recap of our CHSI locations. We do have 2 clinics in Bloomington, 2 in Riverside, 1 on Magnolia and University. We are also located in Moreno Valley and Fallbrook. You can always visit our website to view all of the services we offer at chsica.org. For more information or to schedule an appointment, please contact your local CHSI Health Center, and remember, mental health matters. If you have any comments or concerns regarding this presentation, you can contact your local community relations coordinator. To ensure the efficiency of this presentation, we kindly ask if you could complete a survey. Just scan this QR code with your phone camera or type the link below to take the survey. This concludes the presentation. Thank you for your time and have a lovely day.